Welcome to UMC TV, your connection to good health. Today we'll be speaking about stroke prevention and the Comprehensive Stroke Center at University Medical Center of El Paso.
Stroke isn't a heart attack. It's really a brain attack. It happens when blood flow to the brain is cut off because there is a blockage in one of the blood vessels to the brain, or one of the blood vessels of the brain actually ruptures. That leads to damage of certain areas of the brain that causes symptoms such as weakness in one side of the body, weakness in one side of the face, slurred speech, impairment of the vision, or even loss of balance. There are two main types of strokes. One is ischemic stroke, that is probably the most common. It's about 85 to 87% of all strokes. It can often be treated with a clot-busting medication when actually it's caught early enough. With an ischemic stroke, we also had to consider what we call the transient ischemic attacks, or TIAs, also known as mini strokes. Although they don't cause permanent injury, it is really a warning symptom of a stroke that may come in the future. The second type of stroke, and often the most severe kind, is called hemorrhagic stroke. This is where a blood vessel in the brain ruptures, which leads to extreme pressure or swelling and requiring surgery. Even though the hemorrhagic strokes are less common, they're often responsible for about 40% of the deaths in stroke. There are many risk factors that can cause stroke, and it's important to be aware of them. High blood pressure is the number one cause and probably the most important risk factor for stroke, and because of this, it should be checked regularly. Atrial fibrillation, which is a form of irregular heartbeat, can cause poor blood flow within the heart, and that leads to the creation of blood clots within the heart, causing strokes. Smoking is another important risk factor, as it doubles the risk of stroke because it damages the blood vessels and causes the heart to work harder to pump blood. People with diabetes and high cholesterol are also at higher risk of having strokes. Simple changes can help prevent strokes. Just 30 minutes of exercise several times a week, maintaining a healthy diet and avoiding fatty foods can lower your blood pressure and be great for your health. However, your best defense against stroke is knowing how to identify the symptoms, and you can do that by acting fast. Ask a person to smile. Does one side of the face droop? Ask them to raise both of their arms. Does one drift or doesn't move? Ask a person to repeat few words. Is their speech slurred or confusing? If you see any of these symptoms, call immediately 911, as time is important. While stroke can be scary, getting treated quickly can definitely improve the chances of a positive outcome. UMC Certified Comprehensive Stroke Center is the only nationally recognized Level 1 stroke center of El Paso. We specialize in the diagnosis, treatment, and early rehabilitations for all types of strokes. When a patient arrives, our stroke team jumps into action using state-of-the-art equipment to determine the best course of treatment in less than 45 minutes. That's actually faster than the national average of 60 minutes. Our team of board-certified neurologists and neurosurgeons is available 24/7 to provide life-saving procedures for even the most complex of strokes. We're also the only stroke center in the region to have around-the-clock dedicated neuro ICU staffed by highly trained nurses who specialize in stroke treatment and rehabilitation. Basically, this all means that if you or someone you love experiences a stroke, UMC's Comprehensive Stroke Center is dedicated to getting you the best results possible. Thank you for your time and attention, and I wish you good health.
For more information about the Comprehensive Stroke Center, call 915-544-1200.